It's a college party, a Friday night. You're 19, you've been drinking before, but never like this. Someone hands you a drink, then another. The shot starts somewhere around 10 p.m. You're laughing. You feel warm, confident. The room loves you tonight. You don't know that your blood alcohol content is already climbing past the point where your body can safely process it. You don't know this because alcohol has a delayed absorption curve. What you drank 30 minutes ago hasn't fully hit your bloodstream yet. You keep drinking. Alcohol is not a stimulant. It feels like one early on, but that's because the first thing it suppresses is your brain's inhibitory control centers, located in the prefrontal cortex. The part of you that second guesses, worries, holds back, that goes quiet first. What's left feels like confidence, freedom, euphoria. But underneath that, alcohol is doing what it was always doing, acting as a central nervous system depressant. It binds to GABA receptors, enhancing the brain's primary inhibitory neurotransmitter, and simultaneously suppresses glutamate, the primary excitatory one. The net effect is a progressive slowing of neural activity across the entire brain. At 0.08 to 0.15, you feel warm, loose, happy. Your coordination is impaired, but you don't notice. Your judgment is compromised, but you feel unusually certain about everything. You have another drink. Somewhere past 0.15, the euphoria begins tipping. Your cerebellum, the structure governing balance and fine motor coordination, is now significantly suppressed. Standing requires concentration. Walking requires focus. The room tilts when you turn your head too fast. You feel nauseous. The area of the brainstem called the chemoreceptor trigger zone is being activated by alcohol in the bloodstream. It signals the vomiting center. Your stomach contracts. Vomiting, at this stage, is your body trying to expel a poison it has correctly identified as dangerous. It is protective. It may save your life if it happens now. But alcohol also suppresses the gag reflex. If you vomit while your gag reflex is impaired, you may aspirate, inhale vomit into your airway. This alone can kill you, but we'll come back to that. Your speech is slurred. Your friends think you're funny. You think you're fine. Someone suggests you lie down. You agree. You curl up on a couch or a bed somewhere, and within minutes, you're asleep, except it's not sleep. Not exactly. This is the part that kills people. When you stop drinking and lose consciousness, the people around you often assume the danger is past. You're sleeping it off. You're fine. You are not fine. Alcohol already in your stomach, and small intestine continues absorbing into your bloodstream while you're unconscious. Your back is still rising. It will continue rising for 30 to 90 minutes after your last drink, depending on what you ate, your body weight, your metabolism. You drank enough tonight that your back, still climbing, is going to pass 0.25. Then 0.30. You don't feel this happening. You are unconscious. But inside your brainstem, the alcohol is reaching the structures that don't get to take a night off. Your brainstem is not like the rest of your brain. The cortex handles thought, personality, memory. The cerebellum handles movement. These can be heavily suppressed and you survive, just impaired. The brainstem handles the things you never think about. Breathing, heart rate, the reflex that keeps your airway open, the signal that tells your diaphragm to contract every few seconds without you asking it to. These are not optional. There is no backup system. At blood alcohol concentrations above 0.25, brainstem function begins to be significantly compromised. Breathing slows, not dramatically at first, just a few fewer breaths per minute. Your oxygen saturation begins to fall. Carbon dioxide, which your body needs to expel, begins to accumulate in your blood. Your skin, if anyone is watching, is becoming pale, slightly bluish around the lips, a sign called cyanosis, the visible result of deoxygenated blood near the surface. Your heart rate is slowing and becoming irregular. You are breathing approximately 6 to 8 times per minute. Normal is 12 to 20. You are making a sound, a low, irregular, rattling breathing pattern that people who work in emergency medicine recognize immediately. Almost nothing. This is documented and important to understand. At back levels above 0.25, the brain's capacity to form conscious experience is profoundly suppressed. You are not lying there suffering and unable to call for help. The systems that generate suffering, that generate any experience, are the same systems being shut down by the alcohol. What little neurological activity remains is not producing coherent thought or sensation. There is no internal narrative, no fear, No awareness of your own breathing slowing. There may be fragmented, disconnected imagery, something vaguely dreamlike, formless, with no emotional register attached to it. Some resuscitated patients from alcohol overdose describe this. Most describe nothing at all. Your body's last semi-conscious act may be a reflexive gag or swallow, a brainstem reflex trying to protect your airway. It may not be strong enough. Death from alcohol poisoning happens through one of three pathways, often overlapping: respiratory depression. The brainstem stops reliably signaling the diaphragm to contract. Breaths become further and further apart. 10 seconds between breaths, then 20. Then the gap simply doesn't close. This is the most common mechanism. Aspiration, you vomit, a reflexive passive event. While unconscious and with a suppressed gag reflex, the vomit enters the trachea and lungs. You cannot cough it clear. The airway obstructs, or aspiration pneumonia begins, or both. Cardiac arrhythmia. Alcohol at toxic concentrations disrupts the electrical conduction system of the heart, the same way it disrupts neural signaling everywhere else. The heart can enter a fatal rhythm without any structural damage having occurred. In most cases, it is the breathing that goes first. The gaps between breaths grow longer. The oxygen in your blood falls below the threshold required to maintain cardiac function. Your heart, now hypoxic, slows, stutters. There are people 15 feet away from you. Music is playing. Someone is laughing in the kitchen. You are on a bed in a dark room. Your chest rises. It falls. The silence where the next breath should be stretches out. 5 seconds, 10, 20. Your brain, already dim, registers nothing. There is no gasp. No jolt of recognition. No moment where you understand what is happening. The last dream fragment, formless and quiet, simply